Tomorrow is Veterans Day, and that's when the United States honors military veterans who have served our country.
Well, according to the U.S. Department of Veteran Affairs, PTSD is becoming more common with recent wars. They say around 15% of veterans of Desert Storm and the wars in Iraq and Afghanistan, and around a quarter of the veterans there will have PTSD in their lifetime.
So joining us tonight via Zoom is Dr. Duren Gutierrez of Easterseals MORC. Thank you for being here with us.
Thank you for having me.
Would you say that this is a common issue for our veterans to have to deal with?
It is a common issue. As a matter of fact, some statistics, PTSD can cause a lot of difficulties, depression, anxiety, relationship issues, all kinds of things. It's really something that should be addressed.
And what are some ways that us here in the community can help veterans who are dealing with PTSD?
So if you're dealing with PTSD or you know somebody that's dealing with PTSD, you should really seek mental health care. Because there's a lot of repercussions that can come from that. Statistics about suicide, where men can complete suicide 4 times more than women. There's just so many things that you can do. So if you notice that that's happening, if you notice that there's depression or isolation or irritability or increased substance use, seek professional help. Talk to friends that you have. Seek clergy, and then just really find the help that you need. And if you need that, we can help at Easterseals as well.
It seems like one of those things that you really can't truly understand unless you are a veteran walking in their shoes, coming back with those scars from those experiences. You named some of those things there. Are there any other things that we can keep in mind to look out for? How do you even know if you need that help?
So if you notice that you are isolating more, or if you are more irritable, or if you just don't enjoy the things that you used to enjoy, those could be signs that you really need to address some mental health issues. If people are seeing that in you, then I suggest that you seek the help that you need.
Now, what if you know of a veteran, like you said, if they see it in themselves, seek help, but what if they don't see it in themselves, but their family and friends are noticing maybe certain noises or things can be triggers, but the veteran themselves isn't ready to get treatment?
You need to encourage them. You need to tell them and speak frankly with them. Let them understand what you're seeing. Express your concern in a loving way, in an understanding way, in a kind way, not judgmental, making sure that they understand that there is a concern and you're concerned because you love that person and that you're concerned about their welfare.
And we know with that there can sometimes be pushback. Is there a way to address that where it's still loving but yet stern?
Yes, you can address that just by saying, look, I love you. I care about you. I want the best for you. I want you to have the best quality of life, and just do it in such a loving way. Non-judgmental. That's really it. One of the concerns with that is that people are, they have stigma about mental health, and that's true with this as well. So they're fighting with that. They feel like they need to be strong, and sometimes it's very difficult to accept help from people. But we need to provide that support. And don't forget, you're there because you're their network, you're their support, you're their help, and you can do that.
Now, Dr. Gutierrez, is there any way that you can explain to us, maybe who haven't had PTSD, what is that like for the person suffering from it?
PTSD can be very, very difficult to deal with. You can have an increased startle response. If something happened to you, you can be on edge all the time. You can have memories that flood you. Sometimes something that happens will trigger that memory for you, and before you know it, you're living back in that whole incident again. It can be very, very difficult. So if you're experiencing things like that, I truly do suggest you get some help.
And speaking of help, we also want to mention that you do have resources available for people who need that help as well.
Yes, we do. Easterseals MORC is actually the largest provider of mental health services in the state of Michigan. If you go onto our website, eastersealsmorc.org, we have some assessment tools that you can use right there, and they're all free. And by the way, they're confidential as well. You can use those. We're not trying to generate business. We're truly there to help you. You can use those tools. It'll give you an idea of what you need to do, some assessment tools. We have things specific for PTSD. We have a comprehensive tool that's sort of a general tool there. And then we have some tools there that you can use for depression or anxiety as well at eastersealsmorc.org.
All right, you've given us all something to think about as we honor those veterans tomorrow. Dr. Gutierrez of Easterseals MORC, thank you.
Thank you.